Well, good morning, everybody. I'm Andy, serve as the president and CEO of Centra, and we've not really had a chance in a lot of ways to really get to know each other. And I'll start by saying I really don't love the format. I really don't like being formal like this. In fact, I wish we could just have a couple bar stools up here, just pull up a couple chairs and have more of a conversation. Because what we're really trying to do is just give you the information that you need, your viewers and readers need. So while we do have the podium and we do have the backdrop, honestly, I really want to keep this fairly informal and in a lot of ways conversational from that standpoint. So I want to talk with you about a number of things that we're continuing to do as a health system to prepare for the unknown, really. And I think that the challenge for all of us, and I think when we talk to our caregivers, when I'm around in our cafeteria or go to our clinics or see other folks, I think the thing that everybody is struggling with is just the uncertainty of all of this because we really don't know. There are a number of things that I think we can be very fortunate for here in Central Virginia. One of them is the fact that we do have a largely rural geography, that we don't have a major interstate passing through us. And while we often complain about those things may play to our favor with respect to how this all plays out, and we hope that it does, particularly if we take advantage of that and continue to practice what we know we have to do to be effective, and that's social distancing, not congregating together, washing our hands relentlessly, being disciplined about not touching our faces, our eyes, our mouth, or noses, and really doing those things that we know we need to do to prevent the spread of the virus. In addition to that, we're also very fortunate, and I'll tell you, we're super fortunate because of the number of dedicated caregivers we have at Centra. We call all of our employees caregivers because at the end of the day, we are a group of people caring for others and each other. And so whether it's an incredibly talented medical staff that includes our Centra Medical Group physicians or private practice physicians who partner with us, all of our caregivers are deeply committed to their sense of purpose in caring for others and our community, and we're very fortunate about that. And I don't say that just to be saying it. I'm not saying that just because I'm supposed to as the CEO. I'm saying because it's true and it's real. We have incredible people who are really dedicated to the cause, and we've seen evidence of that over the last couple of weeks. One of the big things we've done is really eliminate non-essential procedures. And frankly, we were one of the first health systems in the state to do that. There are still health systems that have not completely taken that step, but we felt that we needed to be conservative for the community, on the leading edge of trying to do the right things to make sure that we can protect as many as we possibly can in the event this becomes a crisis here in our local community. So in doing that, it has allowed us a number of things, and one of the things that it has allowed us is some capacity. So for example, here in Lynchburg, between our two hospitals, we have 360 beds roughly at Lynchburg General, another 160 at Virginia Baptist. And lately, for the past year, we've been over capacity in all of those facilities almost on a daily basis. But since we've eliminated non-essential procedures, we're running a census that's roughly 60% of capacity. So we've freed up a tremendous amount of bed capacity to care for sicker patients in the event that we begin to see more in our community. In addition to eliminating those non-essential patients and reducing the patient workload, it has freed up our caregivers to have a little bit more time, to have a little bit more space physically, and frankly, to have a little bit more space emotionally and psychologically to prepare for what may be coming. And so it's given them an opportunity to catch their breath a little bit, and it's also given them an opportunity to focus on preparations, and it's also given them an opportunity to also just practice some of the things they need to practice to continue to get better at what it is they need to do. In addition to that, we're continuing to think thoughtfully about how we care for our own caregivers. So making sure that not only do they have personal protective equipment, but making sure they understand when they need to use it, how they need to use it, and then how they need to care for it, since we, like all health systems, are being especially careful in trying to conserve what we have. Personal protective equipment was becoming increasingly difficult to find even before the coronavirus hit. And so this has put an additional challenge on us as we've been burdened with the loss of the manufacturers of a lot of this equipment in China as they've dealt with this pandemic before us. And so while I think we are probably better equipped and have more supplies than most health systems in our region, we still have to be incredibly conservative with what we have, and we're taking those steps too. We're also asking that our own caregivers be really intentional and thoughtful about their own decisions. So we're asking them to model good behavior around social distancing. And we're also asking them to stay home. We prefer that they not travel out of the state, and we especially prefer that they not travel to locations where there are shelter-at-home precautions already in place to try to protect them and to protect our communities when they come back. So we're continuing to try to be proactive. Our leadership team is meeting daily to address the issues pertinent to us preparing for what could be a real significant onslaught of patients. So in those conversations, we talk about all aspects of how we're thinking about the preparation, whether it's communication with you all, whether it's thinking about how we make sure we're being good stewards of our financial resources, whether it's making sure that we're really up to date on the latest and greatest infectious disease recommendations to make sure that we're compliant with what we need to be, whether it's thinking about how we prepare for our own caregivers. And one of the areas that we clearly talk about is, heaven forbid, this is a really significant event, how do we continue to prepare for care outside the walls of our existing hospitals? So we have certainly focused on making sure we understand every inch of available care delivery space that we have within the walls of our facilities, and then what could we do if we need more space. So one of the actions we took last week to protect the community and our caregivers was restrict visitation to our facilities. And in doing so, we made the decision that temporarily we would close the Dawson Inn, which is effectively a hotel where patients and often their families can stay while they have loved ones in our hospital for free or for limited charge. And so while we've done that, we also see that as a place that we could repurpose to provide additional care. And so there are 40 what are effectively hotel rooms that could be converted either to private or semi-private care delivery spaces to care for potentially 40 or 80 more patients outside of our hospital. We've also had conversations with local universities, and in particular, University of Lynchburg, which has been gracious in working with us to potentially allow us use of a dormitory room if we need to. University of Lynchburg is appealing to us just because of the geographic proximity to Lynchburg General Hospital, so we wouldn't have to transport patients as far. And so, heaven forbid we have to get to that situation. They've been good partners in working with us to expand another place where we could potentially house patients. In addition to that, we've also focused internally about making sure that we're adequately staffed and have rooms to care for patients in the current scenario. So we've got, at present, 20 intensive care unit beds, the majority of which we can dedicate to COVID-19 patients, and we've created a 36-bed ward for patients that don't need critical care but may need hospital care in the event that they have a COVID-19 infection. We've also have the capability of utilizing an additional floor of an additional 36 beds to provide care for those patients. And we could certainly move other rooms and beds around to create additional capacity if we need to. So those are some of the things that we're really focused on in the moment to make sure that we're really preparing for the things that we need to do. And I'm really proud of our team for the fact that we've really taken, I think, a very proactive stance. I think we've moved ahead of some of the recommendations and have really been able, through our experience, to help partner with other health systems in the state to provide some of our experience and share some of our guidance moving forward, and we're very proud of that. I'll also just state, too, that one of the things that I think has really helped us prepare for this time is the fact that we have brought in a number of new talented leaders to our organization, and they are really blending exceptionally well with many of our seasoned, experienced leaders who have been part of Centra for a while. And so that leadership environment we've created has been really helpful in helping us manage and navigate through times like this. And so our conversations are intense They're focused on the patients and continuously focus on all the right things to make sure that we're really prepared for what's coming and that we're really being thoughtful for our community. So with that, I'll call up our Chief Medical Officer, Chris Thompson, to add some additional comments.
Good morning. Last time we spoke about flattening the curve, and I think everyone has seen that concept and understands that concept very well. And I want to build on that by talking about really some of the epidemiologic curves that people have also seen that describe what happens when we take very diligent action today versus tomorrow, or yesterday versus today. And those show that as time goes on, that we can ultimately really blunt the impact of this pandemic here in terms of number of patients infected and also potentially lives saved if we get to the point of significant numbers of patients infected. So really stressing that to get back to the point of washing our hands still, not touching our face as much as possible, the isolation procedures and the isolation recommendations that seem to be drastic again, but really do help that number significantly as we look into the future several days or even several weeks. To that vein, I want to describe some great work that's going on by our behavioral health department. So they are beginning to really reach out and brainstorm about ways to understand what's happening when we say the word socially isolate. Imagine if someone is already feeling isolated, and then we ultimately put this pressure on them. So the focus has really turned to looking out into the community to decide and to really define how we can ultimately support those people. And I look forward to presenting some of the work of their brainstorming as we move forward to support individuals that are out in the community. Secondly, the concept I really want to focus on is collaboration. And every point of what I'm going to describe as we get into some of the details and some of the metrics of what's happening medically has to do with collaboration. Collaboration with our local health departments that's been just unprecedented. I didn't know that this ability to collaborate existed. Collaboration with the community who have brought by masks and food and just everything that we need. And the part of this I think that was unexpected was the number of people that said that wanted this to be an anonymous donation. There are certainly a number of people that we want to know about, we want to ultimately advertise, because we're going back to those individuals and they're coming back to us to share resources and share personal protective equipment. But the number of people who are donating anonymously, I really didn't expect. And someone mentioned this morning, if I were anywhere in the world right now, this might be where I'd like to be, and I would agree with that. We have just an unbelievable amount of collaboration, and you're going to hear that as we talk about some of the details of our response and really this regional response to this pandemic. We currently have no positive coronavirus patients in the hospitals in the Centra system. And just to clarify, that includes Lynchburg General Hospital, Virginia Baptist Hospital, Southside Community Hospital, and Bedford Memorial Hospital. We do have some patients where we have pending tests, and those tests, some of those may become positive within the next few days. We don't know, but currently no positive tests in the hospital. One of the great areas of collaboration has been, again, with one of our partners, the University of Virginia, who's been able to develop a very rapid turnaround test within 24 hours. So we have actually taken some of the tests that we've been waiting for our other tester, and we've actually resent them up to University of Virginia to be able to get a more rapid turnaround on some of those tests. As we do that, we imagine the University of Virginia will be inundated with testing requests as well, but right now they have the capacity to really support our efforts in a great example of community and regional collaboration. Currently, our LabCorp testing, and LabCorp has really stood up, and it's unbelievable what they've done, but they've also been inundated with demand. Our turnaround time is about 5 to 7 days for testing. And currently we can decrease that number by collaborating with our partners up at University of Virginia, and LabCorp is currently really ramping up their capabilities with other sites around the country so that they can decrease that time, and that's been their efforts. And that being said, their initial efforts to really get testing up, as well as the other testing sites, Quest and Roche's and other companies that have really stood up, has really been amazing to supplement the good work that the federal and state governments have done as well. From a community standpoint, there are now, from a positive testing, COVID testing standpoint, in our catchment area, there are now 5 positive cases. 3 we know about. One over in east at Longwood, we know about the Amherst case, and there's 1 Bedford case. Within the past 12 hours, we've had 2 more confirmed positive cases. We'll know about the details of those when that comes out from the Virginia Department of Health, and they'll announce that both from their press release and also add that to their website as well. From an ambulatory testing standpoint, we continue to have both STIP tents, that's the stabilization and treatment in place tents that I know many have seen outside of our emergency departments, and drive-up testing at each of the sites where we have emergency departments. So that's Bedford Memorial Hospital, Lynchburg General Hospital, Southside Community Hospital, and Gretna Medical Center in Gretna. And those continue to see patients and, based upon criteria, continue to test. Those criteria continue to change, and that's the other theme as we're getting updated information on whether there's community spread in our community. The criteria by which those testing sites will test individuals and have the capacity to test individuals will change. Currently, it includes symptoms with cough and shortness of breath, and still does include travel or known exposures. And again, we'll continue to assess that as we work with both our federal and our state partners and locally to determine, do we, number one, have the capacity to enhance those criteria, but 2, is it useful to enhance those criteria in the community? I want to begin to start a conversation that I think we're going to hear more about over the next week and certainly by next week. And that is that areas that have significant numbers of cases of COVID-19 have really stopped ambulatory testing. And I know right now the focus of many in the community is on this test. And I want to both acknowledge that, but also begin to say, if there are individuals in the community that get sick, the stress or the focus is going to be on not necessarily the test, but ultimately that isolation and ultimately how serious the symptoms are. And in a sense, as we ultimately perhaps begin to emulate, and as the New York experience and other hotspot areas spreads, we're really going to begin to say, hey, if you have an illness that may be flu or parainfluenza or rhinovirus or adenovirus or any of the many, many things that are out there, whatever you have, don't share it with others, and that's going to be the stress moving forward. Today, still lots of ambulatory testing going on. Within the next several days, that may change, and we'll keep everyone up to date on that fluid environment. From a testing standpoint, we have approximately 700 tests remain that we have and are capable of doing right now. It seems like a lot with the volume ultimately that may occur over the next few days. It may not last more than a few days. Just depends on, again, what happens and who presents over the next few days. That's our inpatient and our outpatient capabilities. To date, we have sent just shy of 300 tests in our areas, in our catchment area. And again, that is both inpatient and outpatient tests. We've received results from over 1/3 of those tests and have many, many more pending. And again, that window currently of 5 to 7 days to receive a test result that we're working and that industry and other academic centers are working to decrease still has us having close to a couple hundred tests out that are pending that will get resulted in the coming hours and days. Lastly, I know Andy mentioned ICU beds and our capabilities. We currently have again, significant capacity. We're in a good place right now, but we're not being complacent. We're really planning on what would be a mild, moderate, or severe scenario moving forward, and we have different scenarios that each day we're modeling through to decide what decisions need to be made that day and what needs to be implemented that day. We have a current capacity of about 100 ventilators. I know that's a big question around the country is, hey, how much ventilator support do you have? The government just flew in 400 ventilators to New York to support their efforts. We have a significant capacity now. We have more on order, again, for the worst case scenario, but feel really good about our ventilator capabilities now and really our abilities to turn any of these other rooms, both within the hospital or perhaps even other areas, into ICU rooms that are ICU capable if possible. And with that, I'll stop and take questions.
been a recent report about red eye, and that is a symptom for those who think they may have the virus. Can you speak to that? Have you heard that before?
Yeah, I regret I haven't. So I'll look and see where those reports came from. Red eye or conjunctivitis certainly is the initial symptom of other viral illnesses as well. And whether there's some that are specifically, getting that as their initial symptom and then ultimately testing positive, I don't know enough to speak on that, but look forward to looking into it.
You said there are no patients in your system that have tested positive for COVID-19, but there have been a few recent positive cases in our area, including, you mentioned, 2 in the past 12 hours.
That's right.
So where are these patients?
Where are the patients in the community? They're in the community, they're sheltering at home. Yeah.
Yeah, and just to clarify, many of those patients have been tested at our drive-up facility, but they haven't required care in a physician practice or in our hospitals. So after they're sent home, asked to self-quarantine until the results come back, and then when they're notified if they're doing well, then they just continue to treat themselves at home. So we haven't had any within our facilities to date.
You mentioned ventilators. What about masks? We've heard reports of doctors and nurses in hospitals are running short on masks. They're having to reuse them or share masks. Are you guys seeing any of that going on?
Sure. So masks have definitely been an area of focus. At the moment, we're doing just fine. We have plenty of masks. I think the desire, and it's very understandable, is to have the highest degree of mask that provides the greatest amount of safety, and those are the respirator masks. So the N95s that you've heard much about, and then the purified air-powered respirators as well, kind of the hoods that go over heads. We are both in good shape. We're in better shape given many of the donations that have come in. The supply chain still continues to be a bit gummed up for those items, but is opening up. And as manufacturers get into the business of ultimately making those masks in increased quantities, we're getting more and more. We are probably in a better place today than we've ever been during this in terms of capabilities for both just normal surgical masks, for N95 masks, and then for the PAPRs that we just mentioned as well. That being said, the question becomes, how long do we need to last with this supply? And given the uncertainty of the supply chain, we need to use them when they're needed, and that is something that is ongoing. The other, it is amazing, and it's what's happened in the community, is the outpouring of cotton masks that have been provided by the community, and it not only is wonderful, but it's also going to help us. Cotton masks certainly are not as protective as manufactured masks. They get moist, and they may lose a little bit of protective capabilities as well when that happens. But we certainly can use them for patients. We certainly can use for visitors that ultimately have low risk of being in a COVID-19 area. And so at the moment, we're doing well. We have also our supply chain and inventory team. That's all they're doing. 24/7 is tickling the supply chain, continuing to man our personal protective equipment store, which we have now, which is an internal store that people can go to get their equipment. So, thank you.
Yeah, just to add to that, we are so grateful of the outpouring of support from the community around the cotton masks, and to kind of help simplify things for them, we've now created a collection bin which is in front of our Dawson Inn on our campus. So folks in the community are wondering about where they can go to drop off masks. We've provided that for them so they can do that in a safe way.
In terms of testing, I know you mentioned the cough, shortness of breath, and known exposures as criteria for being tested. Are those the only 3 criteria? If someone comes in and presents symptoms, can they get a test if they have other symptoms? Can you talk about that?
Yeah, it's not recommended in the moment, and so there are a couple of things around the testing that are important to note. So one of them is just the limited amount of supplies that we've had initially with this, and while that's getting better, there's also a limit that the labs have, both the state, federal, and private labs have, to actually process the tests. So now that we've been sending them more tests, they're having a problem with throughput in terms of processing them. So they're starting to prioritize the tests. And so the reality is they're starting to prioritize those patients who had a specimen collected while they're in the hospital and really sick. And then the least prioritized ones are those who've been tested in an ambulatory environment. That's why, to Dr. Thompson's point, as we continue to see more illness as a result of the spread of the virus, and more critical illness as a result of the spread of the virus, those patients with whom those test results can make an immediate difference in changing the care that's delivered are going to be the ones that get done and accomplished first. So they're going to see more rapid turnaround, where some of the ambulatory ones may take a week to come back. And so there really is no need to expand testing beyond that in the moment, because the ultimate reality is it's not probably going to change a clinical course.
We've been hearing a lot about social distancing to flatten the curve. This week, thousands of Liberty students are coming back on campus. Does something like that threaten local efforts of flattening the curve and could potentially overwhelm the healthcare system?
Yeah, so I think all of our local universities are challenged by students who really don't have the opportunity to go home for various reasons. Some of those are international students that can't return to areas that have been severely impacted, and there may be some domestic students that, for various reasons, can't go home. And imagine one who's from New York City, for example, who is not in a position to go into that environment in the moment. And so I think all of them are struggling with trying to figure that out. We have a good collaborative relationship with Liberty and have been having conversations with them and are assured that they're following the CDC guidelines around social distancing, and they've made a number of steps to ensure that their students are safe and the community at large is safe. And so some of those things include closing their cafeterias and preparing boxed lunches, for example, for those who are on campus. And in our conversations, it's clear to us that the leadership at Liberty has great concern and commitment to their to their students, as well as to the community as a whole.
When it was mentioned about being able to add 36 beds to capacity for people needing necessarily ICU treatment, hospital treatment, is that all within Lynchburg General, or is that specific?
That is all within Lynchburg General, and I think it's important to note that the vast majority of patients who require hospitalization don't require critical care services. And so for many of them, they are requiring things like oxygen and IV fluids, which are things that we can care for on any of our other hospital floors, or if we had to, outside the walls of the hospital if necessary.
And in terms of wording, would it be accurate to say that the people that Centra has tested return positive have mild to moderate symptoms, and that's why they're...
That's exactly right, as will the vast majority of patients. So about 80% of patients are going to have a relatively mild course of the disease, no different than another head cold, and so they have the opportunity to just care for themselves at home in quarantine.
And is Centra doing any kind of check-in with them, or are they just really responsible for their own care?
We do, yeah, no, we do check in, and so usually the first opportunity to check in is when the test results come back, and so we typically have a conversation with the patients, as well as the health department, to make sure that it's a coordinated effort and that the patients are accounted for.
Your nurses and doctors are, of course, on the front line. Some people have questions about things that Centra may be doing to make sure that they're protected. And then also someone is asking about maybe providing child care for some of the frontline folks, if that's possible at Centra.
Yeah, so we are doing a number of things on that front. So Chris already mentioned a number of those, which includes making sure that we do have adequate personal protective equipment. Chris and the team have done a great job providing visual education to all of our caregivers around how to use it, when they need to use it, how to care for it. In addition to that, we've done careful fit testing of the N95 respirators to ensure that they do fit correctly and are truly providing the degree of protection that they're required to do. And then some of the other measures we've made are really also, in addition to protecting the community, are designed to protect our caregivers, including the visitor restrictions, including eliminating non-essential procedures, including asking our caregivers not to travel, both eliminating business travel needs and also asking them on their personal time not to travel out of the state, and then continuing to reiterate to them the things that we all have to do to flatten the curve, as Dr. Thompson alluded to: washing our hands, not touching our faces, maintaining adequate social distancing. So we've put a lot of thought, energy, and effort into making sure our caregivers continue to remain as protected as we possibly can during this. On the child care front, Michael Elliott, who's in the back of the room, has done an incredible job of partnering with some of the local community resources and also surveying our caregivers about understanding what their child care needs are. So we're in the process right now of marrying up the results of our survey with the availability of some of those resources in the community to try to figure out a way to try to provide additional child care for them, particularly now since the schools are going to be closed until the end of the school year.
I have a medical question.
Mm-hmm.
What do we know in terms of how long recovery takes if a person does contract COVID-19? And then once they do recover, what immunity looks like?
Yeah, so good question. So on the first part about the duration of the illness, it really depends. So there is going to be a subset of the population that's going to be infected and not know it. They're not going to have any symptoms. For those that typically have a mild case of the illness, it's going to feel like a protracted cold. So it lasts for a couple of weeks. For those who ultimately require either hospital or intensive care, it's a much longer course. So it's probably about 6 weeks until full recovery. So it's an extensive period of time. And so that's something to think about. Now, we don't know for sure whether those who've had the infection are then conferred immunity in the event that they are re-exposed to the virus. There's every reason to think that that's probably going to be the case. That tends to be the case with other viruses, including other coronaviruses. So we've not seen anything yet to give us a sense that that won't be the case. But we've not done surveillance testing for immune response in patients who've had the disease yet to know that. I'm sure that's something that will happen in the following months.
I've heard nurses at other hospitals are asking for baby monitors so they can monitor the conditions of the patients that are in isolation. Are you guys in need of any baby monitors? Is there something you guys are using?
Chris, I haven't heard that. Have you heard that?
I've
Or do you
not heard
have?
that.
Yeah, I don't know. I don't know. Now, having said that, we do have monitoring options for patients, particularly critical patients in critical need today that kind of help us centralize some of that function. But I've not heard the direct conversation about baby monitors.
What are your recommendations for people who previously volunteered within the hospital? I ask because someone says that they used to volunteer with Virginia Baptist and now they're not sure what the center's recommendations are.
So we've had conversations with our volunteers and really given them the option of whether they want to continue to volunteer or not. And I think it's sort of been a mixed bag of who's continued to stay with us and who's wanted to say, you know, we'll figure out another way to support the health system. And a number have done that. A number have said, you know what, I'm in that high-risk population, but, you know, I may go home and make masks or do something else to kind of support the health system. So we're grateful for all of our volunteers.
Is Lynchburg doing something that would warrant the low numbers that we're seeing? And also for those in the community who seem to doubt what we are hearing, what you're saying in terms of the numbers of cases, a lot of people just think, well, how are we dodging this quote-unquote bullet?
Well, I think there's a number of things you've got to think about. So first of all, our general geographic isolation compared to other communities is certainly playing to our favor. So we've got a population that's spread over a large geographic area, and the neighboring regions are also smaller populations spread over a large geographic area, so we're not on the doorstep of a major metropolitan area. Some of the areas where you're seeing the really severe numbers of cases, New York City, Los Angeles, Seattle, for example, they're clearly major destination cities with international airports, lots of intersecting interstates. They also have really high density dwellings, so you have lots of people who are living in very close proximity, something that we really typically don't have in Central Virginia. And so all of those things are enabling us to have a lower community rate of the disease, presumably, than those really large metropolitan population areas. At the same time, too, I think it's important to keep a couple of things in mind. So we've asked about what is the average length that you have the condition. The reality is, as we see death numbers climb, so this morning we were over 500 who've died in the United States, and 100 died in the last 24 hours. So when you think about those 100 who died in the last 24 hours, the average time from the onset of symptoms to death is roughly 20 days. So they've had the disease for 20 days on average before they die. In some cases, they were exposed 14 days before they developed symptoms. So it's possible their exposure was 5 weeks ago. 5 weeks ago, we were only reporting just a handful of cases in the United States, which lets you know that these people were there was already much more disease than we thought. But because this disease takes such a long time to actually cause symptoms, and then once you get symptoms, it takes such a long time to get over it, that the reality is there's a huge delay in any of our efforts. So if we start making a change today to see whether or not it's going to have an impact, we're going to have to wait 3 or 4 weeks to really see the ultimate impact that it's going to have. And the reality is, based on what we are seeing, we know that more and more patients are going to continue to get sick and die over the next couple of weeks. In fact, in talking with colleagues in Seattle, as bad as they've had it in Seattle, they don't expect to peak for another 8 weeks. So whatever we're seeing there now, it's only going to get worse. So that's why, to Dr. Thompson's point, we have to do all that we can today to make sure we're trying to stop the spread of this virus. That's why the social distancing measures, the hand washing, the good hygiene, the common sense are so critical today.
Are you in favor of Governor Northam's new guidelines? And some say they're too stringent. What do you think?
Yeah, and so I'm not an economist, so I can't speak to the economic or the business impact, although I recognize it's harsh. But the reality is, as we are fighting this war against this virus, as we mentioned last week, we don't have bullets we can issue to people to shoot the virus. The way we shoot the virus is by distancing ourselves, washing our hands, not touching our face, not traveling. So I think anything that helps us achieve that is ultimately going to make a difference in terms of the amount of disease that we see. And the reality is, we may not be able to stop the virus from infecting large numbers of Americans. But to Chris's point, if we can slow the rate at which we are infecting Americans, then it will keep us from overburdening our healthcare systems. It'll allow us to continue to have the capacity to care in an appropriate fashion for all of those who need the care, and that's why this is so important, and that's why every day matters.
For experts who say there's going to be a quote-unquote the second wave, do you adhere to that?
We just don't know. I think there's a reasonable sense that that may occur. So, there are a couple of theories around how this is going to proceed and progress, and no one really understands, to be honest, what we're going to see. The virus has a mind of its own, figuratively, although not literally. The virus may start to show a normal decline, as we see with other viruses like the flu virus, as the weather gets warmer and the humidity increases. No one really completely understands why we see the flu go away in the warm months. We think it has to do with increased humidity, more moisture on the lining of the lungs that makes it harder for the virus to attack the lungs, but no one knows really for sure. It's possible we may see this start to quell and get better in the summer, but then there's every reason to think that if we relax some of our hygiene standards, or if it follows a typical flu distribution, then next winter or next fall, as the flu season starts to get worse, this may get worse too. There are others who feel that this may just be sort of a continuous level of infection, and we may deal with waxing and waning waves depending on our and other countries' diligence around social distancing.
So you guys are restricting, obviously, elective clinical visits for people now, regardless of age.
We are.
And kind of speaking of, this is obviously not a week's thing, it's a month's thing, about how you're going to go about that rescheduling process and versus
Yeah.
like over the phone and such.
So I'll give you a couple thoughts on that. So one of the things we are doing is we're expanding our telephonic and virtual care options for our patients. We have the ability to engage our patients today through all of those medium to make sure that they're getting follow-up and appropriate care. And there is a reality, as much as I hate to say it as a family physician, that while I would have patients come to my clinic and I would listen to their heart and lungs, patients didn't always really necessarily need that. What they needed was follow-up on their medications, looking at their laboratory data, and making sure everything is up to date, making sure that we've closed gaps in prevention, and we can do all of those things virtually. They don't necessarily have to come to the physician to see that. And then, of course, if they're sick, we can still see them. So if patients do have acute needs, we can still see those and accommodate those patients in our clinics with a provider today. In addition to that, as we're thinking about what's going to happen, we recognize that by putting off non-essential visits and by putting off non-essential procedures, we are creating a backlog. And so as we are thinking about what is immediately in front of the car as we're driving down the road with COVID-19, we're also looking farther down the road. kind of at that mid-range, to think about what is our plan to help deal with the backlog that we are creating as we eliminate those non-essential services in the moment. And then we're also looking farther down the road to think about how we can change and become a better healthcare system to partner with all the residents of our community so they can live their best life in ways that this can help us. So as we think about virtual visits, we're not going to turn those off when COVID-19 goes away. We're going to continue to use those to create more affordable, more effective, more convenient ways to connect with patients, to create greater access and do it for lower cost. As we think about how we're going to utilize our hospital buildings in the future, this has changed our perspective. And so once we get through this crisis, we're really talking about how do we modularize the hospital so we're no longer restricted with walls and elevators and floors to thinking about how we care for patients, but rather how do we create almost an expandable ICU that we can flex up or flex down depending on what's happening in the environment. And we're thinking that way more than we ever have before. So we're using this as an opportunity not only to prepare for the immediacy, which we are and taking very seriously, but also think about how we can position ourselves to meet the needs of our community even more in the distant future. Other questions?
Make sure you said that looking into the future, you guys are prepared, looking at options in terms of converting 40 hotel beds that you guys already have at your disposal into care beds, and then also
Absolutely.
talk with University of Lynchburg and other.
We've had conversations with the University of Lynchburg and other educational facilities in the event that we ultimately need to expand care beyond our campus. As Chris said, we're kind of looking at various scenarios and planning through those different scenarios, and we're very hopeful and I'll have our fingers crossed that if we do our part to flatten the curve, we'll be in one of those less severe scenarios. But if we need to, as we go through that scenario planning, then we've got the ability to expand care elsewhere.
A lot of medications are made abroad. Are you at all concerned about how the supply chains might impact your access to certain medications?
Yes, no question about it. So Michael Elliott oversees our pharmacy, and partnering with our finance team and Tom Lawton, who oversees our procurement, we've been asking those questions and looking at opportunities and gaps that we may experience in shortages of critical drugs because of that. And right now we feel relatively reassured that we can get access to most things we need. We'll have to see what happens here in the future.
Do you know if you guys are, I've seen where there's an existing drug, I can't remember the name of it, but it's been used at I believe a 70% effective rate of treating certain symptoms from COVID. I don't know if you guys are prepared or looking at that option potentially.
No, I think the media has focused on chloroquine, which is an anti-malarial drug, which has been talked about in the media. There's been one trial in France that has looked at that. It's a very limited trial with very few patients. 26 patients were enrolled in that initial study. And it's hard to draw a lot of conclusions because it was such a limited study. Having said that, we've had conversations about our participation in some clinical trials to have the ability to offer that to patients who may be suffering from this condition. We're going to make sure, first and foremost, that participation is not going to disrupt our ability to provide standard of care, care for our patients, but we may have the opportunity to provide some of that. These are good questions. Other questions? So let me ask, is this helpful for you all? Okay, all right, you like this and want us to continue? Okay, we'll continue to do that. We want to be accessible, available to you, and transparent with everything that we're doing on this front.
Anything that you need from us? Is there any information that we're not giving out?
No, I think we appreciate, as always, we appreciate the good reporting around the measures that people can do to protect themselves, and the need to continue to take this seriously in the moment, because we do think that. I'll also tell you too, one of the things that we believe helps protect our caregivers the most is arming them with information. So, for example, we promote the sharing of what we talk about in our leadership meetings. That goes out to the entire organization, so everyone can be aware of what we're doing, what we're thinking, as we try to communicate that. And I think just helping folks understand we are here for you all. As the CEO, I have a responsibility to the shareholders. In my mind, the shareholders are all the people who live in these communities. That's our job and our responsibility. So we're here for you all, and we want to be open, transparent, and provide as much information as we can. So we just appreciate the engagement in a huge way, and appreciate all that I know you all are running hard as well during all of this. So we just appreciate all of you and what you're doing.
Is there anything you want to say directly to people watching at home who might be scared or feeling stir crazy or anything like that?
Yeah, this is a great opportunity to do a number of things. And so social distancing doesn't mean social isolation. Call your loved ones, connect with people, pick up the phone and call people you haven't talked to in a long time. It's a great time to try to take care of yourself. All of us are trying to find time to exercise regularly, stay hydrated, make sure we're getting plenty of sleep. Those are things that can help you both mentally today, dealing with a different environment, but they can also help prepare you in the unfortunate event you ultimately catch the virus. And then certainly doing all of the things that we know we should be doing, the social distancing, the hand washing, avoiding touching the face. Those are all critical things. All right. Thank y'all. Really appreciate it.